Dr. Paul here. We have a young man with a rash. Let's go take a look. Hi. You do have a rash. That's an impressive one. You had mentioned to me that before he had molluscum. So if we'll take a closer look there, that's a molluscum lesion. And it's a flesh-like, solid, slightly raised, whitish looking little papule, a little bump. And he's had those for a few months, right?
At least 6 months, yeah.
For the viewers, molluscum is a wart virus. It's called Molluscum contagiosum. Horrible name. It's really no big deal. What we're seeing is we have little red dots that's how it starts. Then we get fluid in these, and then they break open. You can see these are crusted. Some of these are crusted. There's one there that's crusted, one there, one there. And, of course, viewers are probably horrified that I don't have gloves. I always tease my viewers. This, you folks, is chickenpox, varicella, classic case, because we have all three types of lesions. We have the little tiny red dots. We have dots with fluid in them. Classically, you call it a vesicle with clear fluid, but it can look a little like more colored fluid sometimes, right? Yeah. And then they crust over because it's very itchy. Now, he's actually doing quite well with his itchiness. You're doing great. So what you can do for itchiness, if you want, you can get calamine lotion. Don't get the Caladryl, get the calamine.
Okay.
Caladryl can sensitize people to Benadryl. It's okay to use Benadryl. That's funny. It's okay to use Benadryl by mouth. If he's real itchy, it makes most kids sleepy, but that's okay. Or you could use Claritin or Zyrtec, like a half teaspoon a day of either of those, or Benadryl's every 4 hours, about a half teaspoon of that.
Okay.
That for the itchiness. Calamine lotion if you like. A cool bath sometimes helps if he's just going nuts. Now this is highly contagious, so everybody that's been around him from the day before the rash started until the last one crusts over, he'll be contagious. Okay? And usually he gets new lesions, just like you've noticed, over about a week. So for 5 to 7 days, they're kind of new crops, new little chickenpox lesions coming up. Back when we used to have a lot of chickenpox, this was like normal. I mean, this was like average. You have about 300 to 500 of the, if you were to count them all, and you're looking, oh my goodness, this looks amazing. It's pretty average back in the day. Today, you could throw a chickenpox party and have people pay to spend time with you. I'm just teasing. I'm not really advocating chickenpox parties. I'm just saying there are people who do this to get the exposure so they can have natural immunity. When you have natural chickenpox like he does, he's immune for life. It is very unlikely he'll ever get chickenpox again.
Okay.
And I'm gonna wash my hands, but I'm showing viewers that I'm not afraid of chickenpox. I'll tell you why. I had chickenpox as a child, and you know that more and more people are coming up with shingles. You've heard of that, you know, generally when you're older. Part of the reasoning we think that people are getting shingles is they're no longer being exposed to these little kids who have chickenpox. I'm just getting an immune boost to my immunity against chickenpox by being around you. So thank you so much. You're helping my immunity. I am gonna go wash my hands because I have to see other patients. He will get better in the next week. You should notify anybody who's pregnant. Stay away from people who might be immunocompromised. So chickenpox can be very dangerous if you're, like, say you have cancer and you're on chemotherapy and your immune system is suppressed. One of the big pushes and advantages of the chickenpox vaccine is if we get enough people immune, then cancer patients who have a suppressed immune system, if you're on high-dose steroids for asthma or other medical conditions, obviously it's going to be less dangerous because you're not going to be exposed to as much chickenpox. So that's the advantage of having immunity to chickenpox. The interesting thing is, of course, there's more shingles these days, so that's a whole topic for another video. Thanks for watching. I'm Dr. Paul. Thank you so much. You did a good job. Okay. Yeah. All right, washing away the chickenpox virus. There you go. You got to wash it all down the drain.